Lieutenant Colonel Peter Dinh. Peter Dinh, that is, the physician at Annistion Army Depot's Deer Occupational Health Clinic, joins me this morning to talk about heart health. Sir, good morning.
Good morning, Mrs. Burdell. How are you?
I'm doing well. If I can keep my teeth in my mouth, it'll be a good thing. Let's talk about heart health. What are the major risk factors for developing heart disease?
Well, actually, when we talk about risk factor for heart disease, there are quite a few, but we can kind of divide them into two categories. One is something, might be something that you're born with, that runs in your family, and the other one is lifestyle. So things that you might be born with, maybe you're born with a heart that has an abnormal heart rhythm. That prevent the heart from properly circulating blood throughout your body, or you might have a congenital heart. There's a hole in the wall between that separate the two ventricles or the two atria. And then certain medical condition, either directly or indirectly, contribute to heart disease. But I think the majority that we can contribute to is the lifestyle. We're talking about diet, exercise, bad habits like smoking, alcohol, and things like that. So that the nice thing is that that's the majority, and I think that's something we can do about to prevent heart disease.
Okay, so if there are genetic factors involved, what can we do to reduce the risk?
So going to your primary care doctor, that is always the first thing you should do. Once you meet your doctor, discuss with him or her regarding your family history of heart disease. And I think one of the questions that you normally hear from your primary care doctor is there a history of heart disease in your family? And what he or she wants to know is, at what age did the heart attack occur? Because we all know that as we get older, we have more risk of developing heart disease. But for someone who's in their mid-20 or 30 and they have a heart attack, that kind of indicate maybe there's a genetic component involved. So always discuss with your primary care doctor, and from your history, he or she will make the proper referral to the specialist, and then you can be monitored.
Okay, so because the heart is crucial to our survival, then of course it's best to keep a well-balanced diet.
Yes.
And watch what they're doing on a daily basis. Well, let's talk about the link between smoking and heart disease. You mentioned earlier about secondhand smoke. I'm sure that's just as dangerous.
Yes. So smoking reduces the amount of oxygen that your heart can get, and that's it also increases blood pressure, heart rate. It increases the risk of getting blood clots, and when we talk about blood clots, you can get clots in the artery in your heart, or in the carotid artery that runs up your neck, and then even vessels that's in your brain. So that will contribute to stroke, or you can even get clots in your lower legs, and that can travel to your lung and cause what we call pulmonary embolism. So all those are pretty devastating effect from smoking. So it is, I recommend everyone that comes to a clinic, if they smoke, I said, if you need help, try to get out of it, because that is a big negative contribute to heart disease. And then let's talk about secondary smoke effect. That is just again, you still breathing in the smoke that a person next to you when he or she smokes. So it can still contribute a lot to the negative effect on your heart and your vessels and things like that. So it's very important that people realize the negative effects of smoking and maybe try to stay away from it as much as possible.
Okay, well, let's talk about our diets. With all of the employees we have working here on the depot, we've got to consume some food to keep us going and our stamina up to perform our mission. So how important is our diet to heart health?
Diet is huge, but if I could, I also like to add exercise in there too. Diet and exercise should go hand in hand. So let's talk about diet. What the biggest thing is, try to eat more vegetable, healthy food. cut out the sugary. I'm talking about sweets. We call it simplex carbohydrate. That's like stuff that like from rice, from pasta, white bread. Those are just, they're just purely sugar, and they've been shown to cause obesity. But not only that, inflammation. Inflammation is one important component that causes heart disease. So that's what I would recommend. Eat more vegetable, lean, healthy protein, meat, eggs, things like that, and stay away from the carbohydrates. And then, hand in hand to go with that, exercise. That is huge. Your heart is a muscle. It needs exercise to keep it healthy. And so without exercise, you still won't be able to do everything that you could to prevent heart disease. And you can see this all the time. People with poor diet and leading very sedentary lifestyle. As they get older, everyone either develop type 2 diabetes or high blood pressure. And, a lot of time people go to the doctor to get medication for the two conditions. But, to really keep, even go, prevent it or even reverse the condition, diet and exercise the key. And I can't stress that enough.
Okay, that's some great advice. Any additional tips you'd like to share?
Again, I think the biggest tip that I can give, and I can't stress it enough, is diet and exercise. That is the key. If you can do that, I think you can stay pretty healthy, and you can, prevent heart disease from, from occurring.
Well, Dr. Dinh, we thank you so much for joining us this morning. We all want to live a long, healthy life. Yes. So thank you for your advice.
Thank you, Mr. Burdell.
Okay.